I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at Georgetown Public Hospital Corporation. Today on the program, Your Doctor in COVID, I want to welcome you once again and thank you for joining me. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you can send an email to docandcovid@gmail.com. We continue to have our conversations about the COVID-19 pandemic. And right now in Guyana, we are now in the first week of April 2021. And things are a little bit scary. And we need to pay particular attention to the safety measures that have been advised from the beginning. That is constant washing of the hands, sanitization, social distancing, and most importantly, wearing your mask and wearing it correctly to cover your nose and your mouth. Avoiding crowds, avoiding new people to mingle with and interact with, and to be very conscious if you are around people who are coughing or who have fever, etc. And this is why many of the places of business, we would have persons taking temperature and making sure that you are wearing masks, etc. to enter. Today I will take my mask off using the straps. I'm alone here, so I'm not putting anyone at risk, and no one else is putting me at risk. In April 2021, Guyana would have been vaccinating more than 40% of our citizens and residents. And among countries that are high in population in the Caribbean area, Guyana is doing fairly well. For countries with population above 500,000, then we would have been vaccinating about 4% of our population as of the 2nd of April, 2021. The other countries in Jamaica, Trinidad, they have not yet passed 1% of their population. And we wish all of our Caribbean brothers and sisters well as they continue in their fight against the COVID-19 pandemic. In the Caribbean, the most successful vaccination program has been seen in islands with small populations, those that are 100,000 or less, where they're able to quickly get vaccination of their population done. And you can imagine how much easier it is to vaccinate a population of, let's say, 25,000 than it is to vaccinate a population of 800,000 like Guyana, where people are spread not just on the coast, but in the hinterland region, in the mountainous regions, and it's sometimes very difficult to get access to our citizens in a timely manner so that we could get everyone vaccinated. Luckily, as we are in this phase now of our program, today I believe we would have opened a minimum of 100 vaccination sites across the country. We are still offering vaccines to the 40 and above age group, but I'm pretty sure that in the coming days, not months, in the coming days, we will have the program adjusted where we can accommodate our citizens who are even younger than 40 years, and perhaps we will go to 30 or 25 and above, and persons with comorbid conditions. Remember that children below 16 and below are not yet recommended to have this vaccine, but ongoing trials have been taking place. And so we will know once those results become available. Two main questions we want to ask. Is it safe? And two, is it successful? So the first thing in all of these vaccines that people have to recognize is whether or not they believe the vaccine is safe. From all evidence across the world, in all the millions of doses of vaccines that have been administered, one can conclude that it is a safe therapeutic or medical intervention that has been developed with the use of modern technology. And so once the safety question is answered, now we have to ask the other question. Well, it's safe, but is it successful? And what we know at this point is that all the vaccines, every single one that is available, they are 100% effective in preventing severe COVID illness. They reduce and they prevent 100% of severe COVID. That means no ICU admissions, no death rates, no intubation, going on a breathing machine or a ventilator or life support. So that's very encouraging and is very, very useful to have those kinds of weapons as we fight this COVID-19 pandemic. So if we look at COVID vaccine and the side effects, which is what most people are worried about. Is the side effect going to be bad? Is it something that is going to make people sicker? Are they going to die? Are they going to develop blood clots? Are they going to develop strokes, etc.? So it's important to understand what are the possible side effects. So if you look at the post-vaccine side effects versus the symptoms that people might feel at the onset of COVID-19, a lot of people who develop symptoms from the vaccine, they will develop fever. And this fever usually lasts for less than 24 to 48 hours. If you're developing COVID, you're likely to develop fever with cough. People who have taken the vaccine also have developed fatigue. Some persons would have claimed to have headaches. I myself, when I took the vaccine, I didn't have any headache, but I did have fever and chills. And sometimes you can have muscle pain or muscle ache. And it is not unusual to have pain or tenderness at the site of the injection. Like any injection, you can have pain that follows the injection. The onset of COVID-19 can have its own symptoms, and these are things like coughing, shortness of breath, sore throat or runny nose, and change in taste or smell, and of course fever can also happen. Now, the shortness of breath thing is very, very unique, because you may be sitting down one place and you don't have any shortness of breath. But as soon as you get up and you start to climb the stairs or you move around the house, that's when people can aggravate themselves to develop shortness of breath if they have COVID-19 infection. And it is very useful, those who can have what we call a pulse oximeter, that's that thing you stick on your finger to check your oxygen saturation. If you have that and you can use it, normal pulse oxygen level should be 96% and above. When you start to fall 95% and below, that is when it's cause for concern and cause for you to seek medical attention, especially if there is suspicion of COVID and you have other symptoms of COVID-19. So that's an important thing to actually know. There are common side effects associated with all of these vaccines, and you can look at all of the vaccines and see what the side effects are in terms of their frequency in which they occur. Less than 1 in 10 persons can develop swelling and redness at the injection site with the Pfizer vaccine. The Moderna also can be associated with rash, redness, or hives at the injection site. AstraZeneca can have swelling, redness, or a lump at the injection site. Sometimes there's fever, vomiting, diarrhea, flu-like symptoms. The Johnson & Johnson one can produce fever, redness, and swelling at the injection site. That is less than 1 in 10 people. More than 1 in 10 people can develop pain at the injection site, fatigue, headache, muscle pain, chills, joint pain, and fever in the Pfizer group. Now, mind you, these are all mild symptoms. These are not severe headaches, for example. In the Moderna, more than 1 in 10 people will develop pain or swelling at the injection site, tenderness and swelling at the glands under the arm, headache, nausea, vomiting, muscle and joint aches, stiffness, fatigues, and chills and fever. Remember I told you previously that chills and fever usually are a sign that the body is developing a reaction against the vaccine, which is what it's supposed to do in order to fight off the real infection when you become exposed to it. In the AstraZeneca group, people who get the vaccine, more than 1 in 10 person will develop tenderness, pain, warmth, itching or bruising at the injection site. Some may develop fatigue, chills, feeling feverish, headache, nausea, joint pain, or muscle pain. So you can see a great overlap between the experienced side effects in all of the vaccines. So and these are the more common side effects. They're extremely rare to begin with for severe side effects. But common side effects are the same ones you would get if you get the flu vaccine, if you get the hepatitis vaccine, if you get any other type of vaccine. As your body starts to work against the vaccine component, as it should and it's supposed to, you develop these feelings. You develop the fever, you develop the chills, you can get the fatigue, etc. So this is not something new or unique that happens only in COVID-19 vaccines, but it can happen in all types of vaccines. And that is something for you to bear in mind. The biggest thing that people have become concerned about, and there's a lot of media and press about this particular possible side effect, is the presence of blood clots. Now, in 17 million people who receive the vaccine in Europe, 32 persons develop blood clots. Now, let us determine whether or not that is an unusual occurrence in the general population. DVT is something also known as deep vein thrombosis. This is when you develop a clot in the veins, usually in the legs. DVT occurs in 50 to 80 persons in every 100,000 population per year. So in Guyana, for example, let's say we have 1 million people. That's 500 persons should develop DVT per year, 500. And in the AstraZeneca vaccination group of over 17 million, there were 32 cases of blood clots. So you can do the math and determine whether or not there is any significance in terms of increase in blood clots. And I can tell you from my assessment, the numbers just don't add up. DVTs occur generally equally in males and females, and it is usually seen more so in the greater than 60 to 65 years, especially in the female at that age. And sometimes DVTs or deep vein thrombosis can occur spontaneously or by themselves. The usual risk factors for developing deep vein thrombosis is if somebody is immobile for a long time, that's one. If they have a clotting problem, that is two. And the third reason why they can develop clot is if the inside of the blood vessel is damaged. COVID-19 by itself, without vaccines, COVID-19 by itself causes an inflammation on the inner lining of the blood vessel, and that can damage the inner lining. When that is damaged, the body tries to repair it by forming clots. So COVID-19 by itself increases the presence of clots in people. This is before we started giving vaccines to people. So I hope that would have helped you understand a little bit more about the concerns regarding vaccines and blood clots. people have more blood clots in the general population than in the vaccine group, and people have more blood clots from COVID than in the vaccine group. So venous thromboembolism, or VTE, is a spectrum that occurs, and simple superficial inflammation of the vein can happen, and this can cause clots to form, and those clots can move and go to the deeper veins, and then, or sometimes they can move and go to the lungs. And when they get to the lungs, that is when you develop something called pulmonary embolism. Pulmonary embolism, essentially what that means is that there's a clot that started somewhere else, and it moved from that site, usually from the vein, and goes into the lung. When it goes into the lung, the clot blocks up the blood supply in the lungs, and it can cause pieces of the lung to die. And that's a very serious, severe medical emergency. So these are things that can occur without COVID. They can occur without COVID vaccine, and we have been seeing them for years in our hospital practice. It is not something that is due to vaccines. It is not something that is new. So I hope, again, that this discussion would have helped to somehow relieve your fears and your anxiety as it relates to COVID-19 vaccines and blood clots and other reasons for not taking the vaccine. If you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.